thank you. And he takes... I'm talking to him like he's not here. Sorry.
She looks after me well, my wifey.
I've actually got an orchid which I've kept for our wedding anniversary.
Absolutely amazed. You normally kill everything.
You come for the results, is that right?
And you said to come back.
With a witness.
Unless I wear flat shoes, I've got a job to walk.
Why do you wear heels a lot?
My wife won't let me here.
In 3 weeks' time is my golden wedding anniversary, and my wife wants me dancing.
Oh, does she really? All right, we better get you sorted then.
Would you mind sitting up? I just want to have a good look at your back.
You're going goody.
Oh. Yeah. Got up too quick, I think.
Yeah.
You OK?
It's my age, I'm getting old.
Right.
I can't wear a bra, see?
Yeah. I'm going to press on your back, and I want you to
OK.
tell me if it hurts.
That hurts.
That was it, was
Yeah.
it? That one?
Yeah.
Further down?
Yeah.
OK. Can you come and sit down? Right. I think this is actually related to your back, having had a look at it. What it says on the X-ray is that one of your vertebrae, right in the bit where it really hurt when I pressed around there, there's a little, what they call a tiny wedge fracture. So it means that it's a little bit squashed. And this can happen if your bones are a bit thin, which, you know, unfortunately, as you get older, that often does happen. And then the pain I think you're experiencing is coming from that bone out along your lower ribs. The pain from this sort of thing often goes on for about a month to 2 months. And I know, and it just gradually settles down by itself as the bone gets used to the slightly new shape. It does just get better. Would you like something stronger to take at night time to get you a good night's sleep?
Well, those tablets, they make me sleep, don't they?
Yes, you sleep quite well.
OK.
Yeah, they make me sleep, but I'm nearly out of them now, so...
So let me give you some more of these. All right, I'm sure you'll be feeling a lot better.
Well, I hope so,
soon.
anyway.
OK, thank you very much.
Bye-bye.
Thank you.
My husband would like to make an appointment.
Yeah, what's the problem?
Back.
Oh, back.
Your back, OK.
That Friday
It's
morning.
getting worse.
Friday morning, 10:40.
Yeah, that's good, isn't it? Yeah, Friday morning.
Hang on, no.
Why?
Bed's coming for you.
Coming in the afternoon, darling.
Oh,
and Philip's home all day, and I'm there. Right, that's super duper, lovely.
Right.
Come on, will you?
Lovely, bye-bye. See ya, bye-bye.
Come in, Mrs. Jones.
Thank you. Right, lovely. Where should I put my bits?
Put all your bits on this
There.
bit,
Certainly.
and then sit on this chair for me.
Take that.
And you're here for your lithium blood test today.
Please. Lovely. Oh, this is over jolly nice.
Now, how are you today?
Pretty well. It's lovely.
Sharp scratch. Your veins gone.
You won't believe it. When I had this done in Southmead, somebody spoke to her as she was doing it, and blood shot all up.
Oh, did you?
Yeah, so maybe she's taken it all.
Oh, they are.
Oh, super, right.
So have you got any plans for today?
Yes, I'm going to the hairdresser's this afternoon, thank goodness. I should be glad to get my hair washed. Back to work tomorrow, then.
What, are you still working?
Oh, yes.
Are you?
lovely. I couldn't stay home. I couldn't.
Wow.
No, I enjoy it.
What do you do?
I work on a refund desk. When people bring everything back, I have to check the receipts and mark it in and give them the money back. They're very good, though. They give away quite a lot when sometimes you think, yeah, they've used this a lot.
So how long have you worked for?
14 years. 7:30 in the morning. Never mind. Gets me out the house. I think that's the main thing, isn't it?
Is it part-time?
Oh, yes, yes. But since I lost my husband, I'm so glad to have the extra company of people to talk to.
Yeah, that's the thing, isn't it?
So there we are. Let's get my clothes on. Thank you.
They should be ready about after 11 on Friday.
Oh, right, lovely.
OK.
Thank you very much. Let's pop this away.
All right.
Thank you very much.
Take care.
Right.
Bye now.
Bye-bye.
Right. Do you want a long story or a short story?
I want the story I need to be told. And, I want an interesting story.
Yeah, well, it is interesting because I got this condition called myasthenia gravis.
I saw that. Yeah.
Last year, I was at work And I'm speaking the way I'm speaking now. This is not my normal voice. And my eye was closing. And I just thought I had sinuses because of my speech. So I went to see my local pharmacy, and she said, I think we all call an ambulance. You don't look well. Got taken to the hospital. My heart was fine. They eventually got it down to that I had myasthenia gravis.
Myasthenia gravis is an autoimmune condition that affects the receptors and muscles so that the nerve signals that make the muscles contract don't work as well. And what the patients experience is fatigue. Everything's a huge effort. Their eyes don't work so well. They get double vision, and it often affects their speech as well. This is not a terribly common condition. I think this is only the second person I've ever seen with this, and I've been in practice a long time. So what is happening today?
Basically, I want a ESA form. With my condition now, I can't stand for too long. My peripheral vision has been affected.
How much does it restrict you in terms of what you'd like to do?
Everything. Because I said I got no motivation. And the only way I can describe it to normal people, right, is lazyitis. I don't want to do nothing. I said, because of my speech, people think I'm drunk. So that knocks my confidence, because I said, my job was a CCTV operator and security. And I did that for 14 years, loved every minute of it. And,
but you haven't been able to do it since?
No, but I said, I said, well, get me an alternative.
Okay.
But they gave me like a desk job. I can't focus. I get bored.
Stop.
So, I'm sorry. I do waffle. I apologise for that.
Right. But you only want me to do a form for your work?
Yeah, because I said there's nothing else that you can do, Dr Jewell. I get very isolated now because I said I don't go out.
But you could go out, couldn't you?
No, yeah, that's what I'm saying. But I love my football. I love to go and watch football. And I never missed a game at home. I only seen one game. That's just bringing me down an awful lot.
I think you have to adjust to the state of mind and try and do your best. I mean, I would say, you know, if you want help to make sure you can go to football, go to the club, ask them what they need from us.
Yeah, but again, I do apologise for interrupting. Again, it may seem trivial to you, but I have to go to the club to explain.
Mr. Easter might live for another 20 years or more. And you need to work out what is going to make life worth living.
Exactly.
And do something about it. I agree it's difficult, but it just seems to me that it's important to do the things that will give you a sense of enjoyment. Off you go.
Dr. Jewell,
Nice to meet you.
I appreciate it. Thank you very much indeed. You take care of yourself.
Bye-bye.
Bye-bye now.
Yeah, I'm not supposed to live up here, am I, lately?
I don't know, Hazel. Since I hit 60, it's been downhill, I tell you. I feel like an old crock. Put it this way, the brain don't feel like an old crock, it's the body that is.
Have a seat. Right, what can I do for you?
This business on the eye.
The one right in there?
Yes.
Yep.
I've had one that I dealt with about 2 months ago. Well, I didn't deal with it, dealt with itself. It was right here behind the ear.
Right.
And that one morning, all the thing had burst and come out. So this has been growing at a stronger rate lately than before. It's been there for quite a while.
So would you say it's doubled over how many months, how quickly?
I should have thought doubled over about 6 weeks, something like that.
Right, so that's quite significant, isn't it?
Yeah, it's really.
Is it painful?
No, not at all, no.
And does it affect your vision at all?
Not at the moment.
OK, let me have a closer look. Right, OK. It's about 1 centimetre by 0.6. The way it is at the moment, I think it's a benign growth that's nothing to worry about, OK? Like a wart-like growth, OK? However, the only thing that concerns me about is the rapid growth.
Oh, right.
Okay, because that can be a worrying feature. And like you say, where it is...
It's going. If it does get bigger, it's going to come right into my sight.
Yes, it's a tricky one because for benign skin lesions, there isn't any funding to have them removed.
Oh, right.
Because the NHS, as I'm sure you're aware, has limited amount of funds. So what we need to do is keep an eye on it. Maybe come and see me in another month and I can see how it's changed.
Right.
Okay.
Yes.
As an alternative, if you wanted to have it removed, you could always consider having it removed privately if you wanted to.
All right. Well, it's not causing any bother at the moment, you know, that's the thing.
Yeah. So what I'd suggest, if you don't mind booking an appointment to see me again in about a month, so I can have a look at it again.
Yes, definitely, I'll do that.
Okay.
See you in a month.
See you in a month.
Right.
Okay, bye-bye.
Thank you.
Angela Maggs, please. Yeah. So it's been about a year since I've seen you, isn't it?
Well, for the first time in a long while, I woke up, it was about 2 weeks ago, and had a terrific nosebleed for nearly an hour.
Oh, dear.
It was like clots and things.
So it
and
stopped in about an hour, did you say?
Yes, and I haven't had them before. So that concerned me a bit.
Okay.
The other thing, every so often I have sort of a small light thing dazzles and then a triangle sort of shape of colours, and after about 20 minutes it's gone. I get a bit of a muzzy head afterwards.
Does it matter whether you close your eyes or not?
No, because I've tried to work out which one it is, but there is epilepsy in my family.
Okay, so you're worried it's something like epilepsy?
Yeah. Well, I don't suppose it, I hope not.
I must say, from your description of it, that sounds much more like migraine than anything else. And you can get the visual symptoms of a migraine without the headache.
Yes.
And that's what it sounds like to me.
Angela has been under my care for 10 years, but she very rarely comes to the surgery. In fact, she keeps very good health herself. However, she is the main carer for her husband, who sadly has dementia.
And how are you coping with your husband, is it? How's it going?
He doesn't always realise he's in his own house sort of thing and gets very confused in dressing. But he's been a very good husband and stepfather to my daughter, and the grandsons think the world of him.